together with me and my group member, Lucas, Noel, Wong, Tara and Sunny. Today we will explore what ocular motility is, the anatomy that supports it and why it's so important for clear, stable vision. We will also look into common motility disorders, the tests used to diagnose them, and available treatment. Let's dive in and start with a basic definition of ocular motility and its importance. Ocular motility refers to the coordinate movement of our eyes. These coordinations allow us to focus on objects at different distance and track moving objects accurately. Ocular motility is essential for many daily tasks like reading, driving, and playing sports. Now, let's look at why proper ocular motility is so important. First, it supports binocular visions, which is the ability to use both eyes together. This gives us depth perceptions and lets us see in 3 dimensions. Second, it contributes to visual acuity, helping us maintain clear and focused visions as we look around. And finally, good ocular motility is key for eye-hand coordination. This allows us to coordinate our eyes movement with hand movements for activities like writing, catching, or any task that requires precise visual and physical coordinations. Now, let us move into the anatomy of ocular motility. The eye's movement is managed by 6 extraocular muscles, each responsible for specific motions. The superior rectus lifts the eye upwards and slightly inwards, while the inferior rectus lowers it and also turns it inward. The medial rectus pulls the eye inwards towards the nose, and the lateral rectus moves it outward. The superior oblique moves the eye downwards and slightly outwards, and the inferior oblique raises it and turns it upwards. These muscles are controlled by 3 cranial nerves, activates the superior, inferior, and medial rectus muscles, along with the inferior oblique. The trochlear nerve controls the superior oblique, and the adjacent nerve controls the lateral rectus. Together, they ensure our eyes move smoothly and stay aligned, providing stable, clear vision. Now, I will hand over the presentation to Sunny for his sharing topic. Thank you.
Thanks to Ms. Kim. Hello everyone, my name is Sunny. Today we discuss 2 essential eye movement tests, version and duction, which are crucial for evaluating the functions and range of our eye muscle. We'll also cover how to assess the cardinal positions of gaze. A key part of this test, each component gives us a valuable insight into how the eye muscles are working, both together and independently. So let's dive into the version and duction. Version tests the binocular movement of both eyes, meaning we are looking at how well both eyes move together in the same direction. The purpose of version is to check if the extraocular muscles are working in unison to produce coordinate movement across different directions. So, procedure in this test, the examiner asks the patient to follow a target, moving up, down, left, right, and diagonally. Both eyes should ideally track in together in the same direction without any lag or delay. Recording observations. When recording our observations, we document any movement limitations or overactions. If the eyes don't fully reach a position, we note this a restrict movement or hypofunction. Alternatively, if the eye moves too far, it's termed hyperfunction, which could indicate the issue such as a muscle weakness, nerve palsy, or another motility disorder. Now let's move on the ductions. Unlike versions, duction focus on the monocular movement of each eye individually. The goal here is to determine if any movement limitations are due to the true muscle restrictions or if they are related to binocular coordination. During this test, we cover one eye and ask the patient to follow a target with the uncovered eye, moving it through various directions. We repeat this for each eye separately, allowing us to observe the movement range of each eye individually. In ductions, we record each eye movement range and note any limitations in the directions. So if one eye shows restrict movement, it's usually indicative of a muscle-related issue, as we are isolating the eye and ruling out binocular coordinations. Now that we receive a version and ductions, let's discuss how we assess the cardinal positions of gaze. This is an essential part of this test, helping us evaluate eye movement across different directions. To perform this assessment, I ask the patient to follow my finger or another target as I guide it through 9 specific gaze positions: right gaze, left gaze, upward gaze, downward gaze, as well as 4 diagonal positions: up and right, up and left, down and right, and down and left. Each of these positions tests different muscle functions and help us observe the eye ability to move in the various directions. Procedure during this process, I ask the patient to follow the target as it moves smoothly through each position. Both eyes should ideally move together without any lag or delay. So demonstrating smooth coordinate movement in all directions. So in recording finding, if both tests show normal movement, we would note something like full version in a field. If we observe an abnormality, we might say restricted right gaze or note any abnormal movement like nystagmus. Now let's look at the two main types of cover tests: the unilateral cover test and the alternating cover test. These tests help us identify visible or hiding eye misalignments, also known as deviations, and determine their direction and size. First, the unilateral cover test. This test is used to detect a manifest deviations or tropia, which is a noticeable misalignment when both eyes are open. For this test, the patient fixed on the target at either 6 meters or 40 centimeters. The examiner covers one eye at the same time and watches for any movement in the uncovered eye. If it moves to realign with the target, it indicates a tropia. The directions of this deviation is known as either esotropia, inward, esotropia, outward, hypertropia, upward, or hypotropia, downward. To measure the size of these deviations, the Prism bar is used, and the result is recorded in the prism diopters. Next, the alternating cover test. This test detects latent deviations or fovea, which only appears when the binocular vision is briefly disrupted. The patients again fix on the target while the examiner alternates the covering each eye quickly. This breaks the binocular response and allow the examiner to observe any realignment movements. The direction of this movement is recorded as esophoria, inward, esophoria, outward, hyperphoria, upward, or hypophoria, downward. Like the unilateral test, the Prism bar is used to measure the phoria, and results are recorded in the prism diopters. In short, these cover tests help us understand both visible and hiding eye misalignments, aiding in the diagnosis and the treatment planning. Now let's take a look at two important tests that help us assess the eye alignment: the Meadow-Rope test and the Herbert's test. Both of these tests provide a valuable insight, although they are focused on slightly different aspects of the eye alignment. The Meadow-Rope test is designed to detect the lantern eye misalignment, specifically fovea. Foveas are the deviations that might not be visible without testing, but can reveal underlying alignment issue. In this test, a metal rope is placed in front of one eye, while the other eye views a light source. The patient will see a line of light through the dot and road through the other eye. If the line and the dot align, that means the eye are in alignment. If they are don't, we are document the deviations are horizontal, isophoria, exophoria, or vertical. On the other hand, the Hirschberg test assesses the eye alignment by examining the corneal light reflex. That's reflections of light on each cornea. This test helps us quickly identify conditions like strabismus, where one or both eyes may be misaligned. To perform the Hirschberg test, we shine a light toward the eyes and observe the light reflects on each cornea. If the reflection is centered on the both pupils, alignment is likely normal. However, if it's off-center, it may indicate misalignment. The degree and directions of the deviations are then recorded to give us a clearer picture of the alignment issue. Okay, now I hand it over the presentation to the Miss Tara. Thank you very much.
Hi everyone, my name is Tara. Let's move on to two specialized tests for evaluating eye muscle functions: the Hirschberg test and the Lee-Screen test. Both are essential in detecting and diagnosing muscle and nerve-related eye issue. The the Hirschberg test is used to assess the range of eye movements and pinpoint any weaknesses or overreactions in specific eye muscle. This test is particularly helpful for identifying muscle or nerve issues such as cranial nerve palsy, which can impact eye movement and alignment. In this test, the patient aligns a series of dots across a grid with each eye tested separately. When we look at the results, points that appear closer to the center suggest a muscle weakness, also known as underactions. Meanwhile, points pointed further out indicate muscle overactions. By analyzing this pattern, we can identify which specific muscle or nerve may be affected. Similar to his screens, the Lee-Screen test evaluates eye muscle functions, but with a focus on higher precisions. This test is excellent for detecting subtle or minor deviations that may not be visible in the broader grid of the his screen. During the Lee-Screen test, the patient aligns dots on the finer grid, creating a more detailed pattern of eye movement. This finer grid enables more accurate measurements of even the smaller deviations, which can be crucial for detailed diagnosis or treatment planning. The Hirschberg test giving us a broad overview of muscle functions, while the Lee-Screen test provide a more detailed, precise look at the minor deviations. Together, they offer a comprehensive approach to diagnosing muscle of nerve-related eye issue and tailoring effective treatments. Now, let's discuss two tests that evaluate how well the eyes move when shifting focus and or tracking objects: the sketch test and the smooth pursuit test. These tests give us insight into ocular motility and coordinations, which are cues for everyday tasks like reading or following moving objects. The SCAT test is designed to assess the eye's ability to move rapid, accurate jumps from one target to another. This ability is essential for activities that require quick focus shifts like reading or scanning the environment. For this test, the patient is asked to look back and forth between two targets placed at a certain distance apart. We then observe and record the accuracy, speed, frequency of this movement. Specifically, we are looking for any signs of delay, overshooting, or undershooting. This issue can suggest neurological or muscular problem affecting eye movement control. On the other hand, the smooth pursuit test evaluates how well the eyes can follow a moving target in a continuous, smooth motions. This ability is essential for tracking moving objects like when watching someone walk or following a car in motions. In this test, the patient is instructed to follow a slowly moving target such as a pen or small light with their eyes. We observe how well the eyes maintain smooth. Saccades and smooth pursuit tests are essential for understanding how effective the eyes can switch, focus, and track moving objects. Saccades provide insight into quick, precise movement, while smooth pursuit assesses the ability to follow objects continuous. Any irregularity in this test can point to neurological or muscular concerns. Saccades and smooth pursuit tests are essential for understanding how effectively the eyes can switch focus and track moving objects. Saccades provide insight into quick, precise movements, while smooth pursuit assess the ability to follow objects continuously. Any irregularity in this test can point to neurological or muscular concerns that may need further attention. In studying eye movements, we have several advanced technology available that allow us to record and analyze how the eyes move in different situations. Each of the technologies has its own unique purpose and applications. Let's go through each one briefly. First, video-based eye tracking. Video-based eye tracking uses a camera and software to capture eye movements in real time. This technology tracks where someone is looking and can measure both fixation points and moving patterns. It's commonly used in behavioral research, marketing study, and usability testing. Next, infrared oculography or IROG. Infrared eye tracking uses infrared light to detect eye movements. This works by shining infrared light onto the eyes and tracking the reflections changing as the eye moves. It's very precise and is widely used in virtual reality applications, gaming, and research needing high accuracy. Electroculography or EOG. EOG measures the eye's movement by detecting electric signals generated by eye movements. Electrodes are placed around the eyes to record these signals. This method is often used in clinical settings and sleep studies, especially for monitoring eye movement during REM sleep. Although it's less precise than nerve methods, it's effective for detecting large movements. Scalar search coils are used for every precise eye movement measurements. Here, a small coil is placed on the contact lens that's worn by the patient, and magnetic fields detect the coil's positions as the eyes move. This method provides extremely accurate data, but is primarily used in controlled research environments since it's somewhat invasive. Now we move to magnetic resonance imaging, or MRI. MRI is primarily used to take detailed image of the body's internal structures. When it's come to eye movement studies, MRI can show the anatomical structures of eye muscle and other components involved in movement. This is mainly help for diagnosis structures issue. Finally, functional magnetic resonance image, or fMRI. fMRI differs from regular MRI by focusing on brain activity rather than just structures. fMRI detects change in blood flow to different brain areas as a person performs tests, including those involving eye movements. This is especially valuable in understanding which parts of the brain are active during specific eye movement and tests. This technology provides us with a range of options for recording and studying eye movements, from tracking specific gain points to understanding brain activity associated with eye movement. Let's welcome Lucas to talk about ocular motility disorder and disease.
Hello everyone, my name is Lucas and today I'm here to talk about a topic that affects many aspects of visual health and daily life, which is ocular motility disorder and diseases. This condition can significantly impact not only a person's vision but also their ability to navigate the world with ease. Let's dive into some of the main disorders in this area and understand their characteristics and causes. Firstly, we have strabismus, often known as cross-eye, and what we normally call mata juling. Strabismus is a condition where the eyes are misaligned, pointing in different directions, which can cause visual challenges like double vision, poor depth perception, and difficulties in one-hand coordination. There are a few types of strabismus. Number one, it will be esotropia, where one or both eyes turns inwards. The second one will be exotropia, in which one or both eyes turns outwards. So number three, it will be hypertropia, where one eye turns upward. And number four will be hypotropia, where one eye turns downwards. The cause of strabismus varies, including muscle imbalance in the eyes, neurological condition affecting nerve control, uncorrected refraction errors like nearsightedness or farsightedness, certain eye diseases, and genetic factors. Each of those factors can interfere with the coordinated movement of the eyes, leading to misalignment. Another significant motility disorder is nystagmus, characterized by involuntary, rapid, and repetitive eye movement. There are two primary types. The first type will be congenital nystagmus. This type is present from birth or developed in early infancy. It often affects visual acuity and generally manifests as horizontal or horizontal torsional eye movement. In some cases, these movements are consistent, while in others, they are triggered by specific gaze direction. The second type will be acquired nystagmus. This type develops later in life, can result from neurological disorder, inner ear problem, drug toxicity, or eye diseases such as retinal disorder. It can manifest as horizontal, vertical, or even rotational movement. Unlike congenital nystagmus, acquired nystagmus is often accompanied by additional symptoms like dizziness, vertigo, or even hearing loss. The last condition I would like to address is cardiac nerve palsy. This disorder occurs when one or more cardinal nerves, which control specific head and neck functions, become impaired or damaged. In terms of ocular motility, cardinal nerve palsy can lead to significant issues with eye movement, facial sensation, and muscle control, impacting both vision and facial motor functions. Cardinal nerve palsy can be caused by a variety of underlying factors such as trauma, stroke, or certain infections. In conclusions, ocular motility disorder, whether due to misalignment, involuntary movement, or nerve impairment, affects not only the vision but also essential daily functions. Understanding this disorder is crucial to help those affected lead better lives through timely diagnosis, management, and treatment. Thank you for your attention, and I hope this overview has offered you insight into the complexity of ocular motility disorder and their impact on vision and quality of life.
Thank you, Lucas. I'm Noel. Now I'll be covering endonucleus automopedia, or INO. INO is a disorder that affects horizontal eye movement. This is caused by a lesion in a nerve pathway located in the brainstem, known as the medial longitudinal fasciculus, or MLF. This pathway is crucial because it connects two important nerves. The abducens nerve, the cranial nerve 4, which is located in the bones and controls outward eye movement. The oculomotor nerve, ocular nerve 3, located in the midbrain, which manages inward eye movement. The role of MLF is to coordinate these two nerves so that our eyes move together in a synchronized way. When the MLF is affected by a lesion, it describes this coordination resulting in INO. There are three main types of INO. Unilateral INO. This is when only one side of the MLF is affected, causing one eye to have trouble moving inward. Bilateral INO. In this type, both sides of the MLF are affected, so both eyes have difficulty moving inward. Webino, or wall-eyes bilateral INO. This is a more serious form of bilateral INO, where both eyes turn outward, resulting in a condition known as exotropia when at rest. Next, let's discuss other ocular motility disorders that also impact eye movement and alignment. First, Brown syndrome. This disorder limits the outward movement of the eyes due to a type of abnormal tendon. This limitation is especially noticeable when the eyes are turned inward. As a result, looking up becomes challenging for individuals with this condition. Second, myasthenia gravis, or MG. MG is an autoimmune condition where the immune system attacks the nerve that control muscle. When this affects the eye muscle, it can cause dropping eyelid, also known as ptosis and double vision or diplopia. Symptoms tend to worsen with activity but improve with less. Lastly, Dome refraction syndrome, or DRS. This rare congenital condition means the eye muscle don't work properly, particularly affecting outward eye movement. In DRS, the eye retract or move back and the eyelid narrow. When attempting to look inward, many people with DRS tilt their head to help them see better. Treatment options for ocular motility disorder and disease includes optical correction and prism. Corrective lenses or prism can improve vision alignment and reduce double vision. Orthotic exercise. This exercise aims to strengthen and improve the coordination of eye muscle. giving patients better control over their eye movement. Medication. In some cases, medications are used to help manage symptoms or treat the underlying cause of this disorder. That's all for me. Now I turn it over to Mr. Wong. Thank you.
Good day everyone, my name is Wong Yong Yang. Today I will discuss the treatment option available for managing ocular motility disorders and diseases, focusing on two key approaches: surgical intervention and botulinum toxin injection. Surgical intervention is often considered a definitive treatment for ocular motility disorders, particularly in cases of significant misalignment. The primary objective of surgical is to correct eye alignment by modifying the structure or function of the extraocular muscle. This is achieved through procedures such as muscle resection, or transposition, depending on the specific nature of the disorder. By adjusting the strength or position of these muscles, surgery aims to restore balance, ocular motility, improve binocular vision, and reduce symptoms such as diplopia or astigmatism. Botulinum toxin Botox injection. Botulinum toxin injection offers a minimally invasive alternative for the management of certain ocular motility disorders. This injection temporarily weakens overactive or spastic eye muscle by blocking the release of acetylcholine at the neuromuscular junction. These target muscle relaxing help to improve ocular alignment and reduce misalignment. Botulinum toxin is particularly useful for conditions such as acute strabismus, esotropia, or post-surgical residual misalignment. It may also be employed as a diagnostic or therapeutic tool in complex cases to assess the potential outcome of surgical correction. In conclusion, ocular motility is a fundamental component of visual function, essential for achieving stable vision, precise depth perception, and proper binocular alignment. Comprehensive evaluation of ocular motility utilizing techniques such as visions, duction, and advanced eye tracking technologies offer critical insight into the integrity of the extraocular muscles and the cranial nerves that govern their activities. The accurate identification and diagnosis of motility disorders such as strabismus, nystagmus, and cranial nerve palsies are pivotal for the formulating target and effective interventions. This may include optical correction, orthotic therapies, pharmacological treatments, or surgical solutions tailored to the patient's specific needs. Optimal management of ocular motility disorders significantly enhance visual function and overall quality of life, alleviating symptoms such as double vision, improving visual comfort, and ensuring precise ocular alignment for functional and aesthetic benefits. Thank you.